Dr. Dalbir Singh, President, Policymakers Forum for Mental Health. I think, let me at the outset make a comment that India contributes disproportionately to the global disease burden in terms of mental health. Even though 10% of the disease burden globally is attributable to mental illnesses, India contributes much larger share by having today nearly 56 million cases of depression and another 41 million cases of anxiety disorders. And let me share with you that we have nearly 210,000 cases every year of suicide. That means nearly 700 cases per day. And this is not the actual figure. I mean, I'm told there is a study that reveals that the actual figure, which has come out during a study in Tamil Nadu and Karnataka, is nearly 3 to 4 times higher than this. And for every suicide that takes place in India, there are 15 to 20 more attempts. I have to say it regretfully here that India has the highest suicide rate in the world today. I'm going to touch upon briefly some of the key challenges of mental health. Now, somehow, in the last few decades, one has noticed that mental health is something that we don't wish to talk about. We push it under the carpet or it doesn't get center stage somehow. And of course, it is manifested because of certain societal issues also. There are behavioral challenges. There are things which are rooted in stigma, in ostracization, in discrimination, and in interplay of many forces. But somehow in the last few years that I've noticed that we don't seem to appreciate that interplay that goes on between the mental illness and other form of health problems. We don't seem to appreciate that, or if at all, even within the medical community, if someone has thought about it, not adequate attention has been paid to it. And then over the years, we have also noticed, even though we have a national health policy today, which came into being in 2014 and followed by also Mental Health Act, which we formulated in 2017 and it was brought in 2018, we do not have a suicide prevention policy. One of the major manifestations of mental health in India is suicide, and we don't have any strategy to prevent suicide in India. And unless there is an action plan and a strategy to end this, we cannot end this societal malaise. Like I said before, we came out with a national health policy, which we formulated on the basis of a policy group which worked for a couple of years and made strong recommendations to the government. And in 2014, we actually created a framework which defined the vision, the goals, the objective, and well, yes, technically speaking, it is in consonance with the Sustainable Development Goals of the United Nations on mental health. We did make a policy. But even since 2014, there have been rising number of cases of even mental health as well as the number of suicides. And of course, mental health broadly, I will just briefly touch upon what is mental health. You look around in your society, you have people who are schizophrenic, you have people who have bipolar disorders, you have people who are other associated form of mental neurological disorders, which we call it neuropsychiatric cases at large, are all within the framework of what is mental health in India. And for some reason, they have been given a secondary treatment clinically, public sector, private sector, everywhere. And even today, if at all there is any attention available or any treatment or diagnosis available, it is only in the public sector. There is very little of all this as well in the private sector. But what we need to do in terms of policy is we must see healthcare treatment and attention at the primary healthcare setting level, because that's where 80% of India lives. In primary healthcare setting, there is no delivery of mental health care. These are one of the fundamental challenges, again, I'll touch upon. Then there is a gross shortage of experts and professionals dealing with healthcare. In fact, I have not normally heard of psychiatric nurses even in the cities, forget about in the rural parts of India. So there is a gross shortage of psychologists, psychiatrists, and people who will do therapy to treat you for any kind of mental ailment. And there is shortage of even mental health infrastructure. We have not really thought in terms of building up, upgrading infrastructure of existing health hospital, mental health hospitals, or even building new ones. I have not known of any new mental hospital in the last 25 years anywhere in this country which has come up. And while it has nearly 14% of our national population today suffers some form or the other infirmity mentally, we don't consider it important to build more mental hospitals. Why? Maybe it is not, should I say, exciting to talk about this. People prefer talking about now the pandemic and COVID, and they talk about TB, malaria, and other ailments. Why not mental problems? But mental problems is also a fountainhead. It also triggers all other forms of health problems. Because if you do not understand the interplay, you do not know how much contribution mental health makes in terms of triggering other diseases and infirmities in human body. I am of firm conviction, no matter what are the challenges of health of any kind, governments alone, no matter how efficient, can end that. It is only when the deeper engagement of local communities at large, residents, associations, civil society, NGOs, community-based organizations, it's only when them, and these experiments were tried in Ethiopia, they were tried in Libya, they were tried in many Latin American countries, which have really paid very, very heavy dividends. It's the communities which will end stigma. The government cannot end stigma. It's the community which will end discrimination and ostracization. Bring these people back into the mainstream. Give these people space and dignity of life so that a man who's mentally sick doesn't feel ashamed of the fact that he cannot go to a psychologist or a psychiatrist, that he will be left out of the stream and he will not be treated.